This is the shocking moment when a patient decided to urinate in the back of an emergency ambulance after he had sexually assaulted an emergency care assistant whilst en route to Poole Hospital. In June 2022, an emergency ambulance from South West Ambulance Service responded to a call for help from 58-year-old James Mackey. After the life-saving crew transported Mackey to Poole Hospital, the 58-year-old spat at the medics and sexually assaulted one of them in the back of the ambulance. Once at the hospital, the crew had no choice but to retreat from the ambulance and wait for police backup to arrive on the scene. What happened next was caught on the body-worn camera of a medic who was sitting in an ambulance behind the one that Mackey was still in. Mackey started to damage the equipment in the emergency ambulance and then even urinated on some of the life-saving equipment in the back of the vehicle. This meant that the emergency ambulance was taken out of service for 36 hours for repairs and deep cleaning. Taking an emergency ambulance out of service also undoubtedly put lives at risk, as South West Ambulance Service had fewer resources to respond to the thousands of 999 calls which it receives every single day. The footage shows Mackey ransacking the back of the ambulance as medics looked on, powerless to act. If you're watching this wondering why the paramedics could not do anything, then just think of it like this. Would you risk your job and your personal safety to stop this individual, or would you wait for the police to arrive? Ultimately, emergency ambulance crews do not have the necessary personal protective equipment to detain a violent patient who is damaging NHS property. As police rushed to the scene, every move being made by Mackey was being caught on the body-worn camera being worn by the medic who was in the ambulance behind the one that Mackey was in, and the footage would end up proving vital in convicting Mackey. After officers arrested Mackey, paramedics started to survey the thousands of pounds worth of damage that Mackey had caused in the minutes that he was left in the back of the emergency ambulance. So what became of Mackey? Well, on Friday the 24th of March at Bournemouth Crown Court, Mackey was found guilty of assaulting the emergency care assistant, criminal damage and racially aggravated fear of violence. He was sent to prison for 3 years and must now spend the rest of his life being monitored by the police, as he's been placed on the sex offenders register for life. The female emergency care assistant, who cannot be named for legal reasons, said, "I do my job simply because I want to make a difference. I come to work each day to offer treatment, care and comfort to those in greatest need. When I arrived for my shift, I did not expect to be spat at, sexually assaulted and subjected to threatening behaviour, appalling racial remarks and misogynistic comments. This individual showed utter contempt towards me and my fellow crew members who were simply trying to do their jobs." Unfortunately, these incidents are becoming more prevalent and no one should feel afraid to come to work. Luckily, I was wearing a body camera which captured the assault and the footage was used as evidence. I would like to thank my senior officers for their support and commitment to me during this difficult time. This incident serves as a reminder of the sort of conditions emergency workers are expected to put up with, and why it is vital that we look after our first responders, both concerning their physical and mental well-being, but also by making sure that they are paid a salary which reflects the sacrifices which they make. After all, these people are here for us in our moment of need, so we must make sure that we can do all we can to be there for them. Alan Packwood, Crime and Violence Reduction Officer at SWASFT, said, "What happened to our female crew member is shocking and completely unacceptable. James Mackey assaulted them while they were trying to help him. The criminal damage to the ambulance resulted in the vehicle being taken off the road at a time when the service was already stretched. As an organisation, we will prosecute any individual who assaults or abuses one of our people while they are at work. Please help us to help you and treat them with the dignity and respect they deserve." The incident with Mackey is unfortunately not an isolated case. NHS staff face an alarmingly high number of assaults each year. According to NHS Protect, in 2020 to 2021, there are over 121,000 reported physical assaults on NHS staff in England alone. This figure represents a significant increase from the previous year and highlights the escalating problem faced by our healthcare workers. Several factors contribute to the rise in assaults on NHS staff, including increasing pressure on their healthcare system, substance abuse among patients, and long waiting times. The pandemic also further exacerbated these issues with increased stress levels, uncertainty, and fear, making the situation even more volatile for healthcare workers. In response to the growing problem, the government has implemented the Assaults on Emergency Workers Act 2018, which increased the maximum sentence for assault on an emergency worker from 6 months to 12 months. This legislation aimed to offer greater protection to our emergency services personnel, including NHS staff, and deter potential offenders. The NHS is also taking steps to support its staff and reduce the likelihood of assault. Many NHS trusts have implemented training programs to help staff manage challenging behaviour and de-escalate potentially violent situations. This includes training in communication skills, risk assessment, and physical intervention techniques. To further protect NHS staff, there has been increased collaboration between the NHS and local police forces. This partnership ensures a faster response to incidents and helps gather the necessary evidence to prosecute those who assault healthcare workers. The use of body-worn cameras, like the one that captured Mackie's actions, have been a vital tool in this effort. Campaigns such as the hashtag Protect the Protectors movement aim to raise public awareness about the dangers faced by emergency workers and the consequences for those who assault them. By highlighting these issues, these campaigns hope to foster a culture of respect and support for our emergency services personnel who work tirelessly to keep us safe and healthy. Despite the disturbing rise in assaults on NHS staff, it's important to remember that the majority of patients and their families appreciate and respect the vital work our healthcare workers do. By raising awareness, supporting campaigns, and reporting any witnessed incidents of abuse, we can all play a part in protecting our dedicated NHS staff and ensuring they can continue their invaluable work in a safe environment. Remember, our NHS staff are here for us when we need them most, and it's crucial that we stand up for them and show our unwavering support. As always, we'd like to say a massive thank you to our channel members for supporting our channel. If you'd like to become a member of our channel and get access to exclusive content, then click on the link pinned in the comments. Think of YouTube's channel membership as their version of Patreon. Another way of supporting our team of former emergency services personnel is by sending us a super thanks. We always respond to every super thanks that's sent in to us, so it's a great way of interacting with our team, especially if you've got any comments or questions. And finally, if you're still here, we would really appreciate it if you gave this video a like, because it means that more people on YouTube will get to see it. And if you haven't already, don't forget to check out our other videos and to subscribe to our YouTube channel. Until next time, stay safe out there.